Okay, good evening. My name is Chris Thornley. I'm the chair of the Board of Health in Monroe. Today is Wednesday, April the 13th, and this meeting of the Board of Health of Monroe has been called to order approximately 6:22. Please allow me to confirm the members and staff that have been and anticipated participants that are here and can hear me. You will ask to identify themselves so I can place your name next to the call line. Nancy Baralt is already there.
Here.
Mary Porter is already there. I have Enid and Chris Davis.
Yes, here, present.
Okay, thank you. If Mike Hurley can join us later, then great. We hereby have a quorum and call this meeting to order. A copy of the agenda and related materials have been posted to and can be found on the Town of Monroe website, www.monroect.org, for public inspection. This meeting is being conducted remotely in compliance with the Section 1 of Lieutenant of Governor Lamont's Executive Order 7B, dated March 14th, 2020, using the Zoom electronic conference technology. This technology, the public shall participate in real time, the meeting via computer, tablet, smartphone, or telephone using the access information set forth on the meeting agenda. Please be advised each meeting has a unique participation information, so please be sure you access the correct meeting. Notice this meeting is given that only 250 participants may access this remote technology, and is granted by the technology provider on a first access basis and is therefore not controlled by the Town of Monroe. While it is anticipated we will not exceed this participation limit for this meeting, should it appear we are approaching said limit, so every member of the public is not denied access to this meeting, I reserve the right to adjourn and continue this meeting at a later date using technology appropriate to ensure all members of the public may participate. Please take notice the following regarding this remote electronic public meeting. This meeting is being conducted in real time. This meeting is open to the public. Any member of the public may listen, view this meeting anonymously. That this meeting is being recorded, and while we ask that you mute your microphone unless directly speaking to the matter at hand, anything that you say, do, or displayed on your screen may be part of the recording. This recording shall be posted to the town's website within 7 days. This recording shall be made available to the public within a reasonable amount of time in town hall or upon written request. This meeting shall follow standard parliamentary procedure. Prior to speaking on each occasion, we're a pretty small group, so it's pretty informal, but clearly state what you're trying to speak about. As long as it's the topic at hand, just kind of go for it. The use of the chat feature is prohibited and will not be considered during the meeting use. As set forth on the agenda, this meeting will feature public participation. I have not received any written comments from the public between the agenda date and today. Therefore, if I receive anything during the meeting, I will go ahead and read it. Otherwise, we are clear to start. Thank you very much. All right, going right to our agenda. As previously said, I have no public participation issues at this point, so we'll move right on to letter C, the approval of the minutes from the meeting on February the 9th. I'm assuming you guys have read this information. Everything looked good to me, so I will motion to approve said minutes.
Second.
Okay, Nancy seconds. Mary?
Mary, you're on mute.
Yeah, I forgot I was muted.
Yeah.
Aye.
Okay. Chris Davis?
Aye.
Okay, excellent. Motion carries unanimous. Minutes are approved from the meeting on February the 9th. And at this time, I will go ahead and mention that Mary Porter has given her notice that she will be leaving the Board of Health, upon which she is able to hopefully have the town Democratic Committee find somebody for a replacement for her. We certainly, thank you for everything that you've done for us, Mary, and certainly wish you well in the future in all your endeavors. So thank you very much. If there's anybody else that'd like to say anything, please do so. Otherwise, we will go ahead and move right to Nancy. And you can start with letter D, Nancy, and go ahead.
Okay, there you go.
I'm just going to say quickly, after tonight's meeting, I'll let Nick Kapoor know that that was announced in the meeting because they do have a candidate that has to go before the Democratic Town Committee and whatever first. But so this will be my last meeting.
Okay. All right, great. And again,
Which
thank
is
you
why
very
I
much.
didn't volunteer to take care of that for you, Nancy.
That's all right. I know where you live.
I'm moving. That's why I'm leaving the board.
Darn. Okay. Okay. Can you hear me?
Yep,
Yep.
go ahead, Nance. We're good to
Okay.
go.
Good enough. All right. So let me start off with the environmental health activity report. Our routine food service inspections are still down, but just to you might know this already, but we have a new position, a sanitarian position that is in the budget, and so that is going to address that issue, and that we'll be able to get the help that we need to get all of our inspections done. And I'm very hopeful, and we'll be very glad when they come on board. So that's what those numbers are there. The work for well permits, we're up to 92%. That's line item 12. Go down to, let's see, line item 16, 71% for commercials. Soil testing per lot, we're pretty good there. We're a bit low on the B100 applications. We haven't seen a lot of additions or pools or decks or sheds that requests coming in so that we can review those applications. We're at 35% so far this year. And if you scale on down the list here to item 22, 24, 26, all those are plan reviews, permits to construct. You'll see there that the numbers are higher for residential, new commercial. So those numbers are pretty good. So it's a mixed picture on what's happening out there as part of our inspection and requests to inspect. Let's see. So that's pretty much that's all that I have for the environmental health services report. Does anyone have any particular questions?
No questions. When I was, just looking at everything, yeah, the B100s are way down.
Yeah. I wouldn't, they're going to pick up because of the season that we're in, but I don't know if we'll actually get to what we've projected.
Yeah, I mean, we only have basically 2.5 months left.
Yep.
To make up, roughly 65% of what we haven't done for the rest of the year. So we're only at roughly 35% of budget with how many we were supposed to be doing. So it seemed like, last year when we, were putting these numbers together, it seemed, the smart and prudent thing to just kind of continue on, projecting out,
Sure.
which, just remaining flat. Thinking that, more people are going to do more construction with COVID and all that sort of thing. And that certainly hasn't panned out that way.
No, I really, and so when, moving on to the revenue report, you'll see, and, I can point out a couple things on there, because just so that the work, when we get the money in first, it's the work that shows up later. So the report's always a little behind. If somebody wants to build a house and they submit an application for soil testing or maybe a plan review for new septic system, what happens is we get the money up front, but it might take a month. It could take maybe 2 weeks to 2 months later before you wind up seeing the inspections and everything showing up on the work report. Really depends on when the builder gets their ducks in a row. to have the structure constructed. And the soil testing, the installer out there to do the soil testing. So everything takes time. So that's, what you see up front for the money is more real time.
I'm also wondering, there was a lot of home buying without inspections. There was a lot of property moved, but a lot of people were skipping the inspection part because they weren't needing mortgages, and it's the mortgage companies that require the inspection.
Sure.
And that may be a big part of why these tests that would be part of that haven't been done, or people were home doing their own, put together the shed they mail ordered or whatever,
Yeah.
and they weren't building it,
I don't know, like for the building department, what their permit structure, how many have come in with them. It's hard to know. But, that's an area that we've always done very well in. But right now we're in a bit of a slump. So we'll see. Any other questions on the environmental health activity report?
No, that seems good to me.
Okay. All right. So then moving on to to our revenue report. I asked Barb if she would also include, if you'll see the 422 column, put a couple stars there, so that you'll see the money that's come in to date, rather than just cutting it off for the third month. You know what I'm saying?
Uh-huh.
So we've just decided it's easier that way it's a rolling report for her, and she doesn't have to delete the numbers for the board report specifically, and you have more up-to-date information. So I think it's a good thing. So I just wanted to report that Barbara was very happy, jumping up and down, happy messaging that we got all of our food service licenses in, the application, and so they're all done 100%. So all that work that she was able to do, the callbacks and the nagging and all of that, and we had a few stragglers for different reasons, but basically we've got them all licensed up now, so that's good news.
That's a great job.
Yeah. Thanks, Barb.
Thank you.
The temporary food service and farmers market applications, again, that number looks pretty low. I don't know if we're going to catch up for the season, but you do have the farmers market that's going to be opening not too long. And it's hard to say, it feels like we might get to 75%, but I don't know if we'll get the entire revenue that we projected. Hard to say. And again, the B100 application reviews, if you look down, we're at 35%. So those numbers are unfortunately a bit low. But yet again, if you look at the septic plan reviews, we've done better. We're at 120%. So a bit of a mixed picture. I don't know if we're going to actually hit our projected budget this year. Might be a little less, could be like 5,000 less. It's not a lot of money overall, but at least I just want to, this is what it seems like to me.
How has department spending been this year? If a lot of the services provided, I think, were probably FEMA associated, so we're reimbursed, right? But will it tip either way, or will it be relatively balanced revenue and expenses?
Well, what happens is that it's a mixed picture. And the way I say, the reason why I'm saying this is that for the ELC grant, which I'll report on it a little bit, we do have money to spend, but it doesn't offset the cost of our staff doing staff work. It will be used with either new staff or purchasing things like folders and educational materials and that. So it doesn't really help the budget in for I think Mary, can't hear you.
I'm not talking.
Oh, okay. So sorry about that. So it's that kind of a mixed picture.
Well, aren't the salaries included in the town budget that's budgeted to the department? And then this
Now
is the
remember-
department's revenue to cover other expenses? Or does the town not budget to cover the salaries?
Well, like for instance, we have Michelle. We hire her as a nurse. She just works under a grant, but she's a new person that just works under that grant, and she's the only one that gets paid out of that grant.
Right,
So it doesn't really change the budget at all. The money
right.
comes
That's
in.
what I was saying. I know that that stuff offsets itself, but if we're behind on revenue, does it,
We can't keep that money. We can only use it for specific things.
I don't think I'm asking clearly, but it doesn't matter. It's fine.
No, tell me.
No, what I mean is, so if this year we only have 80% of the revenue that we are meant to have,
Yeah.
where's the deficit? Like, where don't we have enough money to cover something? Right, because we have to make those balanced
Oh, I see what
expenses,
you're saying.
revenue,
Okay.
right? So are
when
the
we-
expenses
think that.
lower than usual too? Because
Yeah.
of the grants covering things and all that?
The town
Well,
finance department, basically, they plan for these times when, there might not be enough revenue coming in from a department, which brings in the money, like the building department, the health department, or any other. And that doesn't happen on my level. I don't even know how that is equated. Like, is there and I'm sure there is, where's there a pot of money that if the health department was short revenue, that would pay for that revenue? Because really all of this goes right, it doesn't go into the health department's budget directly. It goes right into the town budget. Enid, do you know anything more on that?
No,
I'll just throw my 2 cents in there.
yeah,
We
I
can't
see
hear
your
you.
salary.
You're muted.
Muted? Is that
Chris
better?
Davis
I
is
hear
muted.
you. Yep.
Okay, so I see your salary and every other director's. I don't see any of the intermediary people. In other words, if you have a secretary, I wouldn't see that,
Yeah.
if that's what you're asking, Mary.
What happens, where is, like, if a department falls short, like Public Works, where does the money come from, Enid? To pay for
The
that?
budget. There's grants.
Yes.
I mean, for example, the Pepper Street is 7.5 million, and a lot of that is a grant. And they're starting to work on it, by the way, in case you live over there.
Right.
Because
Yeah, but
now,
what about if we just have more snowstorms for the season than we thought, and the Public Works Department is out a lot because we've had a lot of storms and they're doing a lot of storm clear up?
if they have an extra budget, like an emergency fund, and
Yeah.
that's where all that. Okay, I mean, there's enough money to run the town. It's never going to go broke unless
Right.
you had a huge. So, no, there are emergency funds. So if, let's say, if it was 5 huge snowstorms, they always can find money.
Yeah, I don't think the health department is required to bring in money to support the health department. The
No,
health department
definitely.
salaries and everything else are covered by taxes and already. But we have to charge fees just like anybody else. But so
Right,
if
right,
we
right.
we can't control, and Nancy can't go out and sell people on creating a new B100. We try
Right.
to take our best guess and do what we can for a quote unquote budget. But if
Mhm.
we don't come in and bring in that money, Nancy isn't like a salesperson that's going to be, her salary is going to be cut. It just is what it is. I don't know if that
Right,
helps
right.
answer.
I think that's correct.
You're right. Yeah, you're definitely right that there's extra money if they need it. We're not going broke.
I think there's a number of departments now and again, the income that comes in every year doesn't exactly match their projection. And there are other years when they exceed their projections, like we have, I think,
And
every
To the
year.
fund.
actually. Yeah. All right. So let's take a look. Any other questions regarding that issue?
I'm
Mary,
good to go. Thank you.
Okay. So that's about those are the high points for the revenue report, if you call it high points. But I think, you know, we're gonna fall a little bit short on the proposed budget, but we'll see. There might be a lot more B100s that come in. Hard to know. But we done with this issue? Any other questions?
I think we're good to go. Why don't you go ahead and start talking about some of our block grants?
All right. Well, before I get there, as part of the director's discussion items, we have a calendar that we emailed you as well. And because we're trying to get back on board with you know, planning different events. And so the first one that is coming up, large event that we're planning for is it's going to be National Trails Day, which is on June 4th. So I'm working with Missy from Park and Rec. We're going to set up a table over at Webb Mountain, and we're inviting others to participate in this event with us and promote the use of our trails. The Conservation Commission, I think there's a gal there that's going to be helping us and probably promoting programs that they're working on. Something with, was it butterflies or something? But anyway, I don't know the details on her end yet. So that's in process. The other event that we're excited about, and this is really new, is having a health fair at the senior center in the fall. And so right now it's very preliminary. I did talk to the senior center director, and she likes the idea. So that's always a good thing. I'm probably going to pal up with the Health Improvement Alliance, which is a regional group. And what they do is they can do outreach in communities, provide educational forums and such. And so I'm going to ask them for volunteers to give mini-like presentations. So what I think we can do, rather than it being a health fair where there are those that show up and have their blood pressure taken and maybe get some freebies, it'll be a bit more. It'll be not only that, but also a forum by which there might be 4 different speakers, and people can sign up for whatever speaker that they would like, you know, presentation they'd like to go to. And if we're unable to get the speaker to be there live, we can do it virtual because the senior center has that capacity over there. So it's, like I said, it's very preliminary. The Commission on Aging needs to be brought in over there so that we can figure out what speakers would fit well with the senior center and what's important to them. So that's where we are now with the upcoming larger events that we're planning. So any thoughts from anybody?
No,
good.
actually, that sounded pretty cool.
Yeah. Does anybody have anything else? I know that Mary, that reaching out to Sacred Heart is a really good idea, because maybe when we in the larger room at the senior center, we can have booths set up, and in those booths, maybe there can be some of these students that can really, you know, really provide some really hands-on outreach to some of the seniors or those that come to the senior center. That's a good idea.
It'd almost be like stations. So instead of having 4 things that people have to sign up for one,
Yep.
would be able to go to each.
Right. So I really like that
It
idea.
might work.
Yep. So that's pretty much where we are with that. Any other suggestions? Am I missing anything? When you have the time and you peruse, I think I'm using the correct word, the calendar. If there's anything else on here that is that you're especially interested in, don't hesitate to send me an email, because I might be able to step up and make some of these things happen in a larger forum. Sometimes like promote on July, skin cancer prevention. A lot of that might be a press release, Facebook postings. Maybe the library, we can set up maybe a display of books about skin cancer prevention. You know, that there's that level, and then there's going full blown like National Trails Day and the health fair events. So, but yeah, your feedback would be very helpful in your ideas. So thank you. Okay. Moving on to the grant. The Preventive Health and Health Services grant is done. We're out of the business of doing that right now. We're still looking for a public health nurse, and I'll report on that later, but you really need a nurse to lead that program. So, and this grant itself winds down and has wound down and is done. So I don't know when the next Preventive Health and Human Services grant or Health Services grant will be coming on board. I think the state health department is trying to figure out what they want to include in that grant, because it's not the same every year. Sometimes the grants are programs for outreach for children that have high lead poisoning. Some are housing inspection related grants. So and then this one was really self-care, high blood pressure. So we have to see what develops on that. But for now, nothing new. The emergency preparedness grant, I just finished filling out our financial forms, and I'm working on our deliverable form for last quarter. So this means we have one more quarter to go this year. Some of the activities that are upcoming as part of this grant is attending a tabletop exercise for anthrax. That'll probably happen in the next few weeks, which that should be lots of fun. Any questions on those grants?
No, you said that the first one is done. All the money has been spent, or it's been put on.
Yeah, we could not spend all that money.
Okay.
Because we didn't have the staffing to do it, to be honest.
Okay.
But you have to finish the work within a certain time frame, and if you don't spend the money, it just goes back to the state. And,
I'm sure they'll be happy about that.
oh yeah. And the emergency preparedness grant, like I said, it's a lot of the deliverables under that grant we were able to achieve because we ran clinics, and we had I just scheduled drills at the same time we were running the clinics, so that we could measure throughput of the customers coming in. So it was just very easy to have a drill at the same time we're having the clinics. So this year it was easy getting those deliverables done. So the Health Enhancement Community Initiative Grant, that is it was multi-pronged. One was outreach to businesses that had like little food concerns in their offices and such, to promote, to try to get people to eat better, for outreach like that. There was also promoting breastfeeding for mothers with their new babies. And so we spent quite a bit of that money, but we still had like $3,500 left. And when COVID hit, we couldn't do a lot of outreach. So we were kind of stuck in a lurch. So what we decided to do is I gave the library about $3,000 of that money, and they are buying equipment so that they can have Zoom meetings in over there at the library. And they have the same camera and everything set up, I think, that's in the council chambers. So she was very happy, and we're happy that the town can use the money. We've saved, I think what's left over is like $500, and we plan on obtaining a couple speakers to really use the equipment and try to do outreach for like on topics such as, breastfeeding, the benefits of breastfeeding your children. So I think that was a win for everybody. And when that happens, that grant will be done. The next grant, any questions on those so far?
Even though that grant was supposed to be done in September of last year, they allowed us to do that.
Yep, they went and they gave us all the money up front. And I think other health departments, they were in the same situation. How do you spend the money when you can't do the outreach because of COVID?
Right.
So I called Stratford Health Department because they're the fiduciary essentially. And they're like, no, Nancy, that's fine. You can spend it on that equipment. And I said, we're going to use it. It's equipment that'll be there for a long time at the library, and we'll be able to give, presentations there, and we can Zoom those presentations out to different groups. And you can really reach a lot more people than those that just come to the library to see a presentation in person. So in the end, I think it was a win-win. And I did call Stratford and I asked them if they, would they want the money back? And they're like, no, Nancy, spend the money. So we spent the money. So then the ELC funding grants, there are actually two of them. The first ELC funding, we're spending the money very slowly. It's a lot of money that has come from the state through the CDC. It ends in November 22. It's a $74,000 grant. And some of the money is going to be spent on contracting with a person who will prepare an infectious disease plan for us. So that's kind of moving along now. The council at some point will be hopefully signing off on an MOU, because this money, we are going, $3,000 of the grant will come from our pot of ELC money. And Stratford and Trumbull, they are also going to contribute $3,000 each. So the total cost for this person to prepare this type of plan for us is $9,000. So I know that the town attorney was looking at the language of the MOU, and I suspect that at the next council meeting that might be voted on. So that's good news. So, we're trying to do collaborative efforts, especially with emergency planning, because it just makes sense, because we all work together on our planning, on the plans that we use. There might be some differences, but in general, an infectious disease plan should be the same for the three towns in general. So let's see, the other thing that's happening, we are planning on hiring another contractor to design it's a folder, and in the folder there'll be information materials for restaurants. There'll be other materials for daycare centers, and a third group of materials for salons. And the materials will include things, of course, like protecting yourself from COVID, or what to do regarding COVID-like diseases, how to protect you and your staff and your customers. In addition, there will also be things like how to sanitize your utensils, what are the cooking temperatures for food. So so we're working on that now too. That's the ELC. And I do not believe we will be able to spend that $73,955. And every other health department that I've talked to, they're in the same boat, because they're trying to hire nursing staff or contract with nursing students to promote to promote programs and such under the ELC grant. The problem is the grant is so narrowly focused that it's a lot of money for, we're not doing contact tracing now, for instance. So those are the kinds of things that we have to deal with in the ELC world. Also, there's an ELC2 funding grant that's out. We haven't, I've applied for it. We are waiting to get feedback from the state. That is $71,000, but the whole effort is being hung up at the state for, I'm not even certain why. I suppose it has to do with their legal process of approving the grants and all of that. So that's kind of on hold. But in that grant, what we're planning on doing is hiring a nurse. The Trumbull health department nurse over there. She's part-time. We're going to make her go full-time, and she's going to be working for both Stratford, Trumbull, and Monroe out of this ELC2 funding grant. She's going to be tracking disease for us and things like that. So, but all of this is in process. That is another MOU, and I'm waiting for Stratford to their legal department to approve the MOU on their end, and then she will share it with both Trumbull and Monroe, so that our town attorneys can take a look at it and approve that arrangement. Any other questions or any questions? A lot
Nope.
going on. So
All
Enid,
kind-
you're going
All
to see
kinds of
stuff
cool
come.
stuff.
Yeah, it's a lot. Enid, you're going to see stuff coming your way before you know it.
Okay, and don't say to ask me, I'm home all day, I'm busy, but I can always come and help if you need me.
Yeah. Okay. I have on here the COVID-19 status report. I didn't print anything out there for you specifically. As you know, the variants are circulating in our community. There's another variant that I found out about today that the CDC is reporting, but so far we don't have a case, quote unquote, in Connecticut, but more than likely we do. It just hasn't been found yet. Also, the state epidemiologist, I'm sorry?
Do you know when they actually, how many of the tests done that are reported, because home tests obviously wouldn't show the type,
Right.
but even at the, when they're done in a clinical setting, how many of the tests are actually tested for what type and not just COVID positive or negative?
Do you know, I don't know the answer to that question.
Yeah, I really think we've had none in Connecticut because I don't know that they've been looked at to see.
You can't get it if you don't test for it.
Exactly.
Right.
We've got loads of positive COVID, and a lot of it is home testing. So they're actually, nationwide, they're saying that so many people have home tests now that they think there's an underreporting of what's positive COVID.
Oh,
But
sure.
there's no strain testing involved. So I'm kind of in exactly what Chris said. If you don't test for it, you don't have it. So, we haven't seen any of that new strain yet, but it might be because we haven't looked for it.
That I cannot answer that question. I know that in all the reports that we get through the state database, it doesn't tell you.
No, it's just positive or negative.
It's just positive or negative. But what I can
actually detected or not detected is
right.
They detected right there.
I can
That's all I see in a patient's chart when I look.
Yeah.
Detected or not detected.
Yeah, so that's where I didn't know if they go on to further testing beyond, because I've never seen anything other than in the news where the news reports.
Like where are they getting it?
Strains and stuff, but I don't. And I've tried to find it because you know how I am.
No, what I can do is I will email DPH and just put that question, and I'll get back to you on it. It's as simple as that.
It's determined,
Yep. On the call with the state health department today, they're saying that they're seeing an increase in the number of clusters associated with schools, because a lot of schools, they're not wearing masks, and they're, some of the events, indoor events, musical events where people are closer together, no masks, scenarios like that, they're seeing an increased number of cases. So.
But not seeing an increase in symptoms. That's the good part. The hospitalizations still aren't bad.
Right. Everything is pretty low. It's all good in that regard. The other thing I can report is, and I talked to Ken a little bit about this today, that we are, not only are we giving the first boosters, but the second boosters to our seniors that are homebound. We went back and forth as to should we have a clinic for the second boosters, but our 3 pharmacies that are available to give the vaccine. And I called them up and I'm like, if I were able to make an appointment with you, when's the earliest appointment that I could come down and get my second booster? And they're, oh, this week. So there isn't really a big need at this point to open up with volunteers a whole clinic.
And let's face it, the people who are homebound are probably less likely to be exposed because they're
Yeah.
home.
Because they're homebound. Yeah.
I mean, they leave their house to go to doctor's offices. You have to wear a mask in a doctor's office. But
Yeah. So any other questions regarding the unfinished business or anything you can think of I'm missing?
Nope,
Nope.
thank you.
All right. Now on new business, the staffing review, we've reposted the job for the nurse. I've got applications and I have one person I've got to call back to see if, to see if she's interested in the hours and all that. And then we can maybe schedule maybe an interview with her next week. But again, it's very difficult to find a public health nurse. There are many nurses I have found that work in hospital setting, patient care, direct patient care, but they're not necessarily a public health nurse that feels comfortable speaking to the public about public health concerns, or they have that have the ability or the interest in teaching, and that's what public health nurses are all about.
a lot of people don't even really know, and I can say this because when I was getting my degree in public health, people were like, oh, are you going to do home care? I mean, other nurses. And I was like, no, that's not public health.
It's a completely different, and people I didn't realize it, to be honest. And when Heather worked for us, I have to admit, I took it for granted that she's a great nurse, but I didn't realize how important she was with that education piece, her ability. It's not just bedside manner, it's a lot more that comes with it. And the best public health nurses have all that other stuff besides being a nurse. Let's see. The medical advisor MOU, that has been signed off on and approved by the town council during the last meeting. The Stratford and Trumbull ELC grant funding MOU, I mentioned that previously. That's on its way as soon as Stratford gets me what they need. And I already spoke about Monroe Trails Day.
Yep.
See if there's anything else.
Was there any intent on O'Reilly's part to re-up with that?
Oh yeah, he is the one. I gave him a call.
Okay.
He said, sure, sign me up. I think he just has to sign the MOU at this point.
Okay.
So it's really good news.
Town council meeting, so of course he knows all about it. Mike O'Reilly.
Okay.
I think, I'm just looking at my notes here. I think that is all that I have, unless any other questions?
Oh, very
No,
informative.
obviously you talked about the trail days and, you're working with Trumbull and Stratford and so forth.
The health fair is going to be a really exciting, I think, event. And I can really see this being something that we can do every year. And I never really championed it too much because I've been to many health fairs and I've never really been inspired. You go and you get your blood pressure taken, you might get some freebie handouts, but I don't know if I'd leave to go to an event like that just for that. But I really think that if we have a series of lectures, 2 in the morning, 2 in the afternoon that people can sign up for, I think that would make people much more wanting and willing to come to a health fair. And while they're waiting for their speaker to present, there will be those booths like you're saying, Mary. And I really think that it's all good news. I really do. Also, there's something called, have you heard of this Vial for Life?
Oh, that's old. Yeah.
Do they still have it though? Do you know?
I don't know if it's a vial anymore, and that was around 40 years ago, more
Oh,
than
was
40
it?
years ago. I personally put my parents in the refrigerator with the little twist ties when I still lived at my parents and was a teenager. But I don't know if people go to look for it, if the EMS comes in, I don't know.
Are you talking about like lists of medications and stuff
Where you
like
put
that?
your history in it, and it used to be
Okay.
like a big pill container, and you rolled it up and kept it in your refrigerator, and you put a
Yep.
sticker on the refrigerator that
Saying
said,
that it's
or
there.
a magnet that said it was in there,
Yep.
so that they knew to look for it.
My folks live in Florida in the villages, and every single person that I have met when I've gone down to visit them does that exact thing. Because they're all, it's a retirement community of 100,000 people. So, they all have stuff going on. So they all do this, and they all have that sticker right on the fridge. It's got the sheriff's symbol and everything right on it. You open up the
Oh,
fridge,
okay.
and there's the pill bottle. It's got a list of your meds, basic health concerns, different things like that, contact information, all of
Yeah.
that kind of stuff.
Basically, the forms come with it, and you just fold it in half and roll it up and put it in. Now, my mother recently, when for the past quite a few years, she hasn't had a vial of life for a while. What she has is a page protector on the front of her refrigerator
Okay.
that has a copy of all her doctors, her kids' emergency numbers, and like basically her updated after visit summary from a doctor's office that has all your medications and diagnoses on it.
Okay.
So that was there. But are you talking about like having it be an initiative so that people are more aware and get it in their homes? Because that would definitely be a good thing to do with the EMS.
Yeah, and I was thinking about that because Dennis Condon had mentioned that to me. I'm like, oh, I'd never heard of it. I'm like, well, that would be a nice giveaway, and somebody to promote that. So maybe I can contact EMS and see, maybe they might come with a booth with all of this.
Yeah.
You
The
think?
other thing that used to be, and I know that when we replaced windows in my house, we didn't replace stickers. It was a long time ago.
Yeah.
But when I first moved to Monroe, well, I had no children when I first moved there, but at some point after that, there were decals to put on the bedroom windows of bedrooms where there was somebody that would need help to get out. So young children or elderly, so that if the fire department responded to a fire at the house, they saw what go to this room if it was nighttime to know what bedrooms they should look in. I don't know. I have no idea about what the effectiveness or increase in saving lives is with that kind of thing, but I do remember having those decals on the windows.
See, what's tricky is we have a senior population that goes to the senior center. We have some, but that's not a large
many,
part of the population. And to try to reach that population is the trick. How do you find them? How do you gauge them?
So the senior center, the couple of, the town's senior housing that's over on 111,
Yep.
the condos that are not just over 55, 55 and older, but they're older usually.
Yeah.
And the food pantry is a good place to have stuff like that available or announced.
Or the library.
Mm-hmm. But and also, I know things taped on doors isn't supposed to be the way you go, but you used to walk into the rec department and the door was covered with flyers of what was coming up. People don't tend to go into the health department, but they might be going in for town services, senior services, and, especially when Operation, whatever it's called, it's not called heat, but you know what I mean, Operation Warmth.
Oh, yep.
When that starts up and stuff like that, people are coming in. And there might even be some kind of distribution list from people that are already using those programs that a little public health newsletter could go out to.
That would be really nice if we had the money for that mailer. We could send 2 out a year.
I don't know, I throw those away, but I don't, you know, but again, if there was a distribution list and something could go in it, that would be a great thing.
Well, you know, when people pay their taxes, that is another
But
way.
The older people are still coming in with a check in their hand. They're not doing it online.
Hey,
But I
hey,
didn't do
hey,
my house
I'm not so old
online
and I
'cause
bring mine in.
I didn't do my house online either because you had to pay a fee if you did it on a credit card.
But I think what the town can do is
Like,
they can put a flyer in there from the health department, you know? And it could be, and there could be a section on emergency preparedness.
Never mind in there, because people wait outside the door. So you need one of those cases that you can like put flyers in and just change them out periodically, but outside the door, because people are standing in the hall waiting.
Yeah.
The town clerk's office has a huge bulletin board. It's covered with a lot of dog pictures and other stuff, but they have a huge bulletin board for public announcements too. And people do go in there to either get documents or get dog licenses or get records or all the different things you do at the town clerk's office. So that's another big visibility point.
Okay. Well, these are great ideas. Writing them all down here. I'm just thinking that, you know, I know that health departments and other towns, occasionally, they have put notices in and, you know, got permission to put a flyer in with the tax bill. So that notice then would go out with the tax bill. And I'm just wondering if that would be a nice thing to do, where you could have like 4 sections on a single flyer, and you could have messaging from emergency, you know, emergency preparedness, you know, all of that.
Ken would probably like to be involved in the development of
Oh,
such
no,
a
he
thing.
would. It's a he would.
I'm being nice. So he would probably like and multi-departmental, like a little newsletter.
Like a little newsletter.
Yeah.
What do you think, Enid?
I think it'd be fine. I mean, anytime we get the tax bill, I read whatever's in there.
Yeah,
That's one way. The other thing, if you had some just big flyers, you could, will they allow you, like in Big Y, is there a cork board there or Stop and Shop where you could just put it up?
sometimes you have to get corporate, a corporate okay.
Because the other day there were young kids selling Girl Scout cookies, but I didn't think they could do that. I didn't think Big Y ever allowed it, but there they were, which was great. You know,
Yep.
they get
Big Y never used to allow it. I'm surprised they did.
Yeah, I mean, did you
Because they
see
had
that,
a no
Mary?
solicitation policy. So when CBS was still in that shopping center, the Girl Scout cookies and the Boy Scout popcorn and stuff would always be outside of CBS.
Yeah, but this time it was right in front of Big Y. I couldn't believe it. Anyway, I mean, the more publicity you get, the better off we are.
Yep. Well, that's
What
it,
if you
girls
just
and guys. Any other thoughts?
You know, if you left flyers like where the tax collector is, just flyers,
Yeah,
is that legal? I'm sure.
yeah.
If you left them in the library, because, you know, they have a table like it has the news of the town,
Mhm.
neighborhood news or whatever. That's a place to leave them, but they're not controversial. If I
Yep.
pick it up, I might say, oh, you know, do you have to go to that? Because they have the neighborhood news, I think it's called.
Yep, yep, yep.
Anyway. But also, Nancy, we're one of those sandwich boards on both sides whenever you go out in the public.
Yeah. You're gonna stand out there with me, Enid?
Definitely. It gets me votes, sure.
There you go. There you go.
Look, when I occasionally go to mass at St. Jude's with friends, everyone, you know, I'm Jewish, everyone looks at me and they go, what are you doing here? And I go, I'm getting votes. And I go, so, but anyway.
Wow.
Well, that's it,
Well,
Chris.
say hello, Chris.
I am here. Okay.
Right.
That was a great discussion. Thank you for bringing up the topics. And Mary, thank you for all your knowledge and participation in that. And, we're all sad to see you go, but certainly good luck with all your future endeavors. And, hopefully
Thank
everything
you.
works out exactly the way you would like it to.
I don't have a plan. I've learned
Hey, you
not
know
to
what?
plan.
Sometimes not having a plan is the best plan. Just kind of go with the flow.
You have no choice.
See where life brings you and keep moving forward.
Exactly.
Yep, good.
All right,
Um,
everybody. Thank you.
All
Night,
right.
everyone.
And
So
thanks for keeping Monroe safe. And I was thinking that maybe I should open a tattoo parlor in Monroe since all that time was spent on.
I
That,
don't
but-
know if the ordinances were actually ever pushed through.
It is on Ken's list. That this time I can honestly say I'm not holding it up. By the way, who first and second in the meeting? I was talking over here with Barb.
We're actually going to do that right now. I am going to motion to officially end this meeting this evening.
I'll second.
Okay,
7:20. Yep. Okay.
Bye.
all right.
Thank you.
Bye,
Thanks,
everybody.
Ian. Thanks, Chris, Nancy. and
everybody.
Good luck to you, Mary. Take care,
Bye.
everybody.
Good luck.
Bye.
Thank you for your time.
Thank you, Nancy. Bye-bye.